Welcome back to STL Live. I'm Sarah Bernard, and my guests are Emily Van Schenkhof and Peggy Krokstrom of the Children's Trust Fund. We've been talking about this fund. It's really state sanctioned. It's a part of our government system here in the state of Missouri. Over $1.5 million is going out into the community, and it really starts in the community. It's coming from our citizens, it sounds like, from what we've been talking about. So talk about how you're making decisions on where those funds are going. Emily, Peggy, jump in and let's talk about that.
Well, I'll just go ahead and start and you can add to it. But we have a process that we use to distribute these funds. And so we have a grant process where people submit applications to us. We establish criteria for what we're looking for. And then we receive significant grant applications. And then we have a board committee that reviews it, staff that reviews it, and then we distribute it. We do try to make sure that the funds are distributed not exactly evenly, but that we have a geographic distribution of funds. We try to make sure we're funding a variety of different types of programs, that we're funding innovative programs. We have, most of our grants range from $20,000 to $50,000, but we have 3 large grants that are more in sort of in-depth, really intensive grants that are about $100,000, which are, most of our grants are about that you get them once you apply for them, you get them for 5 years. So they are an ongoing investment over a period of time. And then if you, once that 5-year term expires, you're free to apply again. We are known to be a very collaborative grant-making organization. We form lots of partnerships to achieve our mission. We try to be as user-friendly as possible to our grantees. Our grantees are our partners. We want our funds to be as accessible and easy for them to access as possible. So we want our applications to be simple. We want our communication with them to be simple. And that's something I'm really proud of about the Trust Fund and how we do business.
Peggy, can you share with us some of the grantees here in the St. Louis area?
Sure. I think I want to go back to the process a little bit.
Yeah, absolutely.
So organizations that provide support to families and children in the local community, they might have a really wonderful idea about a local need that they have and that they see, and that's when they'll communicate with us and apply. And so what I think is very important for everybody to understand is it's their local community and the needs that are being met right there, which is really neat. One example of a local one is Crisis Nursery. So for those families that are in a crisis need right away, they can bring their kids here and they'll take care of them and let the adults go handle whatever it is that's going on, and the kids are in a safe location. So Crisis Nursery, I think, is one of our really wonderful area of St. Louis grantees and truly a partner. Emily, who else do we have here?
Nurses for Newborns is another one that I think of. I just visited them about, I think, a week and a half ago and was just blown away by their work. But home visiting services are some of the most evidence-based child abuse prevention services. The Nurses for Newborns helps families that have recently had a young child, so they try to establish relationships with women when they're pregnant, and then help a family acclimate to the challenge of a newborn, and so that child can immediately get everything they need to have a really healthy foundation. I think we probably all know having a newborn is a challenge for anyone. Yeah. And so if you are a young parent, if you have a child with a disability, if you are living in poverty, the challenge of parenting, the challenges of parenting a baby that wakes you up every hour on the night, they're really intense. And so Nurses for Newborns comes in and supports families. They have an amazing facility with they have a whole room full of diapers. They bring diapers to families. They bring clothes for babies if they need formula. So it's about providing wraparound services to families in their own home, and also concrete supports to help ease that transition and make sure that that baby is safe and that family is getting what they need.
Yeah. So the application process to apply for grants, what's the time period for that?
Well, we put out our request for proposals usually around January or February. They're due a few months later, and then they go into effect on July. So it's somewhat of a not too lengthy of a process, but it kind of starts in January, and then awards are made on July 1.
Okay. I would say that's one of the harder parts about being on the board. When we're reading the grants, you want to provide funding to everybody because every single application is wonderful. As Emily referred to, we base it around the state, and we try and distribute funds fairly around the state and hit lots of different needs, but there are lovely organizations.
Yeah, and honestly, it doesn't even sound like that much money, you know, like it's a lot of money, but the need, I can imagine, is very great. So let's talk about that just briefly before we take our next break. The child abuse in the state of Missouri, how extensive is that problem?
I think that people don't realize how many children experience trauma. So the most recognized surveys would say that actually about 20% of children experience some type of trauma in their lifetime or during their childhood. Trauma is also, the more that you have of it, the more it impacts you. So a one-time event is going to affect you differently than chronic abuse and chronic neglect. The more that you that becomes a part of how you grow up, the greater the effects. So we know that child abuse and neglect contributes to things like depression, substance abuse, teen pregnancy, but it also contributes to heart disease. You are more likely to have heart disease if you are abused as a child. Statistically speaking, abusing a child takes years off of their life. So children that were abused, when they're compared to children that weren't abused, typically die 20 years younger than people that didn't experience abuse. So this is a profound public health problem, and which is why our mission is so important to us, because we know that if we can prevent even a portion of this, that we can save our society so much suffering, trauma, dysfunction, health costs. Our children are the foundation of our society,
Right.
and when they get what they need, we have healthy, productive adults.
Yeah, well, thank you both for being here today. You can find out more about the programs and services of the Children's Trust Fund at ctf4kids.org. There's more STL Live after this. Stay with us.